Today I'll be talking about obesity. It's one of the problems which we all are facing. It's a lifestyle change, and there are multiple factors why obesity has come up. It's been already declared as a disease because obesity is just not of being overweight. Obesity comes with many other things along with it. It comes with hypertension, diabetes, polycystic ovarian disease, osteoarthritis, with joint pains, infertility, and many others. So, when we are targeting obesity or overweight, we are not only reducing the weight or making a person healthy, also, we are curing them from all these problems. So, there are different reasons we'll be talking about why obesity comes, how we can treat it medically, surgically, or what are the ways and what are the preventive methods we are going to take to prevent obesity. Now, when we talk about obesity, how it comes, 30-40 years we say or 100 years back, there was no mobile phone, there was communication was all verbal. We used to wait for people to the parking, to the next destination, and again he'll be sitting and doing his marketing work. So lifestyle has come such a sedentary lifestyle. On the other hand, when we talk about food habits, there was a time there were no junk foods available and the physical activities were more. Now junk food has come into the picture. We didn't hear like 50 years back McDonald's, Domino's, Pizza, and many others. So sedentary lifestyle and easy to go, a burger on the go to eat, all this junk food has come in, which definitely is not healthy. These all things aggravate or lead to obesity. But these are not the only reason. There are family reasons. Obesity does go from genetics. There are hormonal issues and multiple factors. When we talk about obesity, the BMI, body mass index, plays a major role. A normal BMI is around 20 to 25. Now, how to know what is the BMI of a person? We divide the weight with height in meter squares. So, if someone is 100 kg and he is 150 centimeter tall, so we divide 100 kg with 1.50 into 1.50, we get the body mass index. Now, weight is one part, height is another. Our joints are made for a particular height. If a 5 feet or 150 centimeter person whose average height, average weight should be around 50-55 kg, weighs around 80 or 90 kg. So the person is 24 hours carrying 30 to 40 kg on his shoulder on daily activities. Now, carrying this extra weight increases the wear and tear of all the joints. Now, when wear and tear of the joint increases, leads to joint pain. If not treated over a period of 20 years, 25 years, will end up for the knee replacement or other issues. Well, that is one reason. Gradually, hypertension, diabetes, they are on the way. Now, first, our target when we talk about obesity or being overweight is to stop gaining the weight. We go to gym, we go do exercise, we go on a diet, we go into a yo-yo phenomena. Our first aim should always be, let me first prevent the weight from climbing. Let's maintain it. Go into the healthy lifestyle, and then automatically you'll see the weight loss is happening and the muscle mass gain is happening. I'll be talking later about the yo-yo phenomena also. Let me start with the medical treatment, change of lifestyle, Then we come with the other treatments like balloon, injection, tablets, and surgical. Well, surgery is always the last option. If nothing helps, yes, we go for the surgery. Now, when I'm talking about obesity, and I've said that the normal BMI is around 20 to 25. So, from 25 to 30, here comes overweight. 30 to 35, yes, is a question mark, and anyone above 35 with one or two comorbid disease requires a surgical treatment, or anyone above 40 BMI, whether he has a comorbid disease in form of hypertension, diabetes, requires a surgical treatment. Before that, I will be talking about the yo-yo phenomena, which is say, I always tell my colleagues, friends, and my patients, never do a dieting. Go on to a diet. Don't starve yourself, you'll damage yourself. Anyone who's 100 kg goes on to a dieting, means he's starving himself, will lose weight. So suppose from 100 he came down to 90. Now this 90 is not, he has reached, he lost 10 kg over a period of 1 or 2 months, but it is not his lifestyle. He didn't change his lifestyle. He did a dieting where he would have gone on a starving or aggressive way of losing weight. So he continues and he's happy he lost 10 kg. Over a period of time, one day, since he has not changed the lifestyle, one day he will eat little, he'll say, okay, I'll eat a little. He may gain a few grams or a few kgs. That will not make an impact. He will say, okay, I lost 10 kg, I can do it again. And then where he start climbing the ladder, and over a period of time, he realized that suddenly he has reached 105. He'll not stop at 100. Now this continues, and he knows that he has done the weight loss before by doing dieting, going aggressive. Again he can do. So continue after a few months, he again goes for the diet, and this time the body stops him at 92. So if you see carefully, from 105 to 92, he lost almost 12 to 13 kg. Here the weight loss was 10 kg. Weight loss is more, but body resisted and he came 2 kg above where he stopped. But he's happy. Okay, I tried my best, I lost this one, I'll again do. And then again he, after a few months, he start, and this time he reached 107. So these are the step ladder we keep climbing by doing dieting. We should not be doing it. Instead, we should use a healthy way to lose weight in form of exercise, healthy food, and good sleep. Now, all three things goes together: a good sleep, a good workout, and a good diet. Any one thing missing, it will not be good. I tell all my patients, if the day you can miss your 3 times meal, you can miss your gym. A healthy fruit salad will always be expensive compared to a burger. 80% of time, try to eat things which you don't like. They will be healthy. We usually end up liking things which are unhealthy. Now, overnight you change your lifestyle, it will never help you. It has to be gradually done. When you are eating bread, rice, chapati, Asian food, or any kind of food, pizza, pasta, suddenly you remove or change the diet, it will affect. There will be a carb withdrawal, you will have sleepless night, again you will go back to the same. So slowly and gradually, start from the dinner, because that's the time where maximum mistake happens with everyone. Daytime we are rushing to our work we are managed somehow because we are busy. Evening when we are tired, that's the time we do all the mistakes. Now there are few sayings our old parents or grandparents used to say: eat slowly, chew properly. Why? There is a medical reason for it. Whatever food we eat comes in a food pipe, stomach, intestine. So when the food reaches the stomach, it sends a signal to the brain, and then when we stop eating. But usually it takes time for the signal to reach the brain. That's why when we stop eating after some time, we feel, oh, we have overeaten. Or we go to a restaurant, we have ordered a food what we can eat as per our requirement. We never over order, but we start with the starters, a soup or something. Once the main course comes, there is a gap between the starters and the main course. In between, the signal has reached the brain, and then when the main course comes, you don't feel like eating. Or the day you are eating, you are very hungry. Suddenly a phone call comes, or a child gets upset, or you move out due to some reason, and you have left the plate where you were eating, you're starving or craving for food, and you knew you'll finish it. You come back after 10 minutes, you don't feel looking at that plate because the signal has reached the brain. That's why when we stand in a rush, we are eating, we overeat. Watching a TV, we overeat. Don't hurry up for food, give it time. Slowly, chew properly, you will eat less. Always speak to your food, what you are eating. If you're hungry also, stop before one bread or two breads, that okay, after half an hour I'll eat you. You will not feel like. Now, once we are done with all the methods, we do come with injections, tablets, and nowadays very much helpful in today's lifestyle is a balloon, where we do a balloon to reduce weight. So what is a balloon? It's a capsule where no surgery is required to put a balloon and no surgery is required to remove a balloon. We just swallow a capsule. I'll show you a sample, what it does and how it happens. So whatever food we eat comes in a food pipe and stomach. So capsule is just, I'll show you over here. This is the capsule. It's attached with a string. We give it to the patient, drinks with a glass of water, it goes inside. Once it goes inside, it reaches the stomach. It has a special marker. We take one X-ray. It confirms that the capsule has reached the stomach, and through this special valve we put a special liquid, and this capsule becomes a balloon. This is the balloon which we get. It stays in the stomach, and this string is just pulled out, it automatically gets sealed. So this balloon stays over there containing around 550 ml of liquid, occupies the space, and you eat little and you feel full. And all the fat which is there around the tummy, thighs, arms get utilized by your body and you start losing weight. We also provide a special BMI machine, a watch along with the balloon, which is calibrated to the patient's phone, where every day when the patient stands on that BMI machine, comes to know what percentage of fat he or she has lost. and how the progress is going and what extra effort to be done. Now, what happens later? There is a special wall over here. In 3 to 4 months, this wall dissolves, fluid comes out, and balloon also comes out while passing stool. So to put a balloon or to remove a balloon, we don't need any kind of procedure. Quite safe and gives a good result. Yes, it's a good method to lose 10 to 15 kg. People do keep coming, whether they keep coming and asking whether they can do balloon again. Yes, they can do a balloon again. Other queries or questions I'll be answering later. I'll come to the next part, surgery. Now, there are different types of surgeries for weight loss. We have to understand, and everyone should know, that surgery is a tool to lose weight. It is not a permanent solution. It's 100% solution for the weight loss, but ultimately you have to maintain by yourself. I'll be explaining you about sleeve and bypass and mini gastric bypass, how they work and what are the results. Now, a simple rule: if someone is 160 centimeter height, just remove the 100, the average to calculate what should be the weight should be between 58 to 63, plus minus. Unless until someone is into bodybuilding, has got good muscle mass, it will be on the heavier side. 160 centimeter is the height and weight is suppose 100 kg. So, if suppose we take in a round figure, the weight should be 60 kg. So the person has 40 kg extra weight. So 24 hours the patient is moving around with 40 kg of extra weight. With surgical procedure, 100% weight loss. How much? Of this, 70 to 80%. Over a period of 1 to 1.5 years, some people lose up to 2 years, which is a slow and gradual weight loss, which is good for the body. So, 28 to 32 kg weight loss, this will happen over a period of 1 to 1.5 years. It's a keyhole surgery. This is the face, this is the belly button. 1, 2, 3, 4, 5. 5 small cut, 5 to 12 millimeter in size. Go inside, do the operation and come out. I'll be speaking about sleeve gastrectomy first before we go to the bypass. In sleeve gastrectomy, why we call it as a sleeve gastrectomy is the stomach, you form a sleeve out of it. Same picture. Whatever food we eat comes in a food pipe, stomach, small intestine. Capacity of the stomach is almost 1.5 to 2 liter. We can imagine a Pepsi bottle of 2 liter. So empty stomach, when we wake up, we can early morning drink almost 1.5 liter of liquid or water, not after having food. So with this keyhole, we go inside and cut the stomach and make it small. And this 80% of the stomach is cut and removed completely and permanently. People do get scared that the stomach is being cut. No, stomach is there. It's here. But a newborn baby stomach size of 50 to 70 mm. Means you eat little and you will feel full. It's same like if I eat 2 burgers, why I stop eating after 2 burgers? Why not after 4? Because the same feeling what I get after when I stop eating, feel fullness, you will get by eating spoonful. Intake of the calorie will be less. and same time the fat which is stored on the arms, tummy, thighs is in balance. Whatever storage is there in form of fat will be utilized by the body, and that's how slowly people start losing weight. This stomach, there is a hormone called as a hunger hormone. So once this part of the stomach is removed, this ghrelin hormone, which is almost 80 here, also goes off. The quality goes out, quantity goes down, life becomes better. This stomach is like a balloon. It stretches and becomes big. So this 70 ml also comes down to around 100 to 200 ml, which is good enough to maintain our lifestyle. Starting from here to reach here, it takes 1 to 1.5 years. That's why we lose weight for 1 to 1.5 years. Some people, they lose weight up to 2 years. That's why the weight loss is for some people up to 2 years. Once size, this is enough to maintain your lifestyle. So after 2 years, there is no requirement of any protein or multivitamin supplement to almost 90% of the people. Yes, till in the process of weight loss, we follow up everyone, and then during that period, we advise everyone to take multivitamins and take care of that. It's quite safe, no cutting here and there, no bypass, nothing, just reducing the size of the stomach. People lose weight and then they maintain. Yes, this small stomach, which over a period of time becomes 100 to 200 ml, if you keep filling it with chocolate, ice cream, or again and again, yes, you may get weight regain later on. That can happen to me or any of the audience who are listening to. So that's why it's a 100% weight loss happen, but to maintain is in your hand. We are there to help you out. Now, what is bypass? Many people, they think or want to know, there are a lot of queries which become, what is bypass? So in bypass, you bypass the stomach. Whatever food you eat comes in a food pipe stomach. So first we cut the stomach from here, and we cut the intestine from here. So next thing what we get is this. So this will give a better idea. When you cut, there will be two ends are made almost the same thing. Now what is done? This A is joined to this A, and this B is joined over here as B. You will. So what we get? When this A is taken up and joined, and the remnant stomach which is cut is there only, and here we come and we join it. So what happens? Whatever food comes, it comes straight into the intestine and comes here. And whatever juices are made in the stomach, they come here and mix with the food over here. So actual absorption starts here. And this stomach pouch is again 50 to 70 ml. So if this distance is 100 centimeter and this distance 50 centimeter, we bypass 150 centimeter of intestine. So these are the group of patients who may require multivitamin or protein supplement for quite long time. This is what we do for bypass. Now, what is mini gastric bypass? In mini gastric bypass is a modification of a sleeve gastrectomy. In mini gastric bypass, we cut the stomach from here to here, and this part of the intestine we come and join like this. So whatever food comes, it comes straight into this small pouch and start going here. So all this distance of intestine from here to here is bypassed. Since one is anastomosis is there, whereas in bypass there will be one and two anastomosis, two joints. So there are different types of procedures which I explained you. All are good, all are tailor-made. We first decide, we put patients on conservative treatment in form of meeting a dietitian, going onto diet, exercise and other method. If nothing works, we definitely go for the surgical part. Bariatric surgery is not a one-man show. It's a team effort which includes your team with a dietitian, cardiologist, endocrinologist, internal medicine, psychiatrist, anesthetist, gastroenterologist, and everyone. So that's why I tell everyone, stay safe, stay healthy. And then I'll now check all the questions and answers which are there, and whatever queries you have. We'll take a break of 2 minutes and start replying to all the queries which every one of you have been asking. Thank you. welcome back, and thanks to all the listeners and the viewers. And I'll be replying to all the queries and the questions which we have got. Maximum of them which was getting, I think I've explained all of them. Well, here gentleman is asking, how safe is bariatric surgery? Well, bariatric surgery is safe. The complication or risk related to the procedure is less than 0.1%, but the program is made in such a way that everything is taken care. In case there is a chance of a deep vein thrombosis, we give blood thinners, we put pneumatic pumps in the leg, though the procedure is only for 35 to 45 minutes when we do a sleeve. On the other hand, when we do a bypass, it is around 1.5 to 2 hours. Now, second question, which is an interesting one, is when can we join work and exercise when we can do? Keyhole surgery, early recovery is the main thing. Hospital stays only 1 to 2 days. Same day we start making patient to walk around, and we encourage them to do at least 1 hour of walking every day, and within a week they should go back to gym. You cannot do anything to break inside any damage. Everything has been taken care. We do all the leak test and everything intraoperatively. So the program is made such that all patients are doing good. Second part to the same question was early to work. The more you move around, the early you will join back. Same. Our next query which is there is thank you. The next question over here which I can see is exercise. It's good, and the first 6 months is a golden period. If we say weight loss will happen for 1.5 to 2 years, maximum weight loss happens in 6 months. This is the time where if you do exercise, you will get the better result. That's why start workout as early as possible. There will be few things, and people, they do come back to me and they say after surgery, because we put them on liquid diet, there's a special diet program where the dietitian is in picture, she takes care of them, that they feel weak, tired, lethargic, they also feel cold. Well, I make them understand they don't feel weak, lethargic or tired because they are not eating. It's the same feeling you will get as if you have done a 2 hours of workout, because your body is utilizing your fat to run the daily lifestyle. So your fat is being burned out, your metabolism is being changed, that's why you feel weak and tired. So what we do when we go to gym, do exercise, and to compensate it, we drink a lot, we hydrate ourselves. So that's why I tell all my clients, my patients, after surgery, to hydrate themselves nicely. Next is a follow-up. Follow-up can be done from anywhere in the world. It's not necessary. We do follow-up after 5 days or 7 days after the surgery or discharge, and then after first month, 3 months, 6 months, and then yearly. After that, after 2 years of completion of the procedure, it's the same follow-up like any cardiac patient or anyone goes to the doctor. We do a yearly routine vitamins and blood test to see how the body is behaving after the weight loss. This is an interesting one. Can a weight loss and abdominoplasty be done together? Well, not recommended. We don't combine a cosmetic procedure with a weight loss, and if sometimes we do abdominoplasty or some people do it, because you are going to achieve more weight loss, whatever tight abdomen we make, it will become loose again. So better any cosmetic or corrective method to be done has to be done after 2 years. Here the next question answers the same thing, which is about corrective method, the cosmetic surgery. Not everyone requires a plastic surgery, means removal of excess skin or upper lift of the breast. Only those few patients who have too excess weight, they may require. But when they are losing weight and if they are going to the gym regularly, the skin gets toned up as per the body, they don't require it. But any corrective measure has to be done after 2 years. By that time, they have stopped losing weight. I think with that we come to the end. I'll almost answered all the queries, and rest will be replying by email and with the call center. Thank you everyone for watching us live. Thank you.